This is the Economic Data Capture Tool Training Narrated PowerPoint for the Improving HIV Prevention and Treatment Outcomes in HIV-Infected Persons by integrating community pharmacist and clinical sites into a model of patient-centered HIV care. The purpose of the cost analysis of the project is to include all of the salient costs, those added as well as avoided, that have been associated with either the structures, the processes, and or the outcomes attained by this project. The economic analysis is attempting to measure the intensity that was required to deliver the model by each member of the dyad, meaning each of the partnered sites. We are looking specifically at the clinic as well as the pharmacy cost associated with delivering the model. Ideally, we are trying to isolate the amount of practitioner time that has been devoted to each patient interaction. We are going to measure that according to the time it takes in January of 2016 and then compare that to the time it takes in the summer of that year to see if there has been any change. We're also very critically looking at support staff time for each time they have interacted with a patient or in which they had to cover an activity that was being provided by someone who is otherwise engaged in the model. That may include other personnel time if there are individuals that have had to take on additional responsibilities to provide services or other aspects in order for this to occur. Then we need the sites to tell us who these individuals are. We are trying to capture the cost for supplies and equipment, materials, facilities, and utilities. And then once we have this information, we're going to begin aligning it and trying to correlate it to the outcomes that were able to be attained to see if there were any relationships. The cost form, the clinic and pharmacy will both be collecting it once they have achieved what we're calling an early steady state of service provision. That will begin in January 11th and run through February 5th, as each of the sites now have the service up and running and are no longer recruiting and enrolling. Over a 1-month time period, we are going to have you complete the economic cost forms on a weekly basis, and then we are going to follow that up by repeating it in July and August or August and September. It is critical that the information you provide to us be replicable as well as defendable. You may be asked questions about the information that you have provided, so please understand that we are not challenging your numbers, we are simply trying to verify your numbers. I would like to begin by initially encouraging everyone to use the contact information that's provided by for Dr. Schomer, which is at the end of this presentation, both his office phone as well as his email, to communicate your questions to him in regards to aspects that should or should not be included in this, or even ways in which to categorize and or label activities involved at your site that may be even tangentially related to this project. Each of the sites are going to have unique costs associated with it, and we may be able to globally link those, whereas individually we would not be able to identify this. If you would now look at the cost form, the first 2 pages, well, the first page is a title page, but the second page has a number of sections that begin on it that start with recruitment activities, and then all the way through the 3rd page of that packet, it ends with other activities. We would like you to, beginning on January 11th, by individual staff person that's participating, on a weekly basis, capture either the minute per the patient encounter or the hours per week that were spent on the project. This will be captured individually for each person on the project, so please be sure to note the staff ID number and the number of hours that person spent into these general categories. Did they spend time on recruitment activities? If so, what was the amount of time? When preparing for patient encounters, this would include the documentation that may have to be reviewed for the patients that were coming in that week. How much time was spent with the patients during that weekly time period? And this may include time when the patient was not actually in the clinic, but time spent reviewing and verifying information about that patient's MTM sessions or other activities. You're going to follow that on with time spent interacting with the pharmacist. If that occurred any this week, how much time was that associated with? if there was a project meeting that week, project-related meeting, whether it be their conference calls with us, or if your individual site has routine meetings or even impromptu meetings related to this project. Time also spent documenting the patient information forms, if you completed that this week at all, or if you had to answer a query or answer a question about a form. Please include that information as well. The next page lists other activities, and we don't know what those are, but we're hoping you can tell us that there are other things going on at your site that you have to do in order to deliver this model. And it's critical that you inform us of those so that we are able to capture that information. We need you to tell us how many project patients you saw that week, the number that came through, and it may very well be both the number that came through but also the number that were scheduled, because you may have incurred preparation time even though the person did not show up. So please feel free to, you will have this as an Excel document, please feel free to add in that note. We prepared for 7, but only 3 came in. This is important information for us to be able to delineate our costs. The next is for that particular week. How much time was spent supervising those who were participating in the project, and what were their ID numbers? Were there general administrative or other activities that took place this week that had to occur or had to happen in order for this model to be delivered at your site? This next slide just gives a little bit more information and reiterates a couple of things that I mentioned on the previous one. You can add more lines as necessary if you want to capture all of the staff on one form, or you may have everyone complete their own forms. Please capture it as hours per week. If it's simpler or you have another mechanism by which you'd like to capture it, please just contact Dr. Schomer and we'll get that translated for you. Please think about all of the particular staff that may be involved and identify them distinctly or uniquely so that we are able to capture that information. The next forms then focus in on training, office supplies, and things of that nature. We would like you to look at the amount of time, the amount of costs that were associated with the physical delivery of this. So if there were supplies costs or material costs or equipment costs, you could include that, but we would like you to include that on a per month basis. And so that is how we would want you to capture that and report it back to us. The next section will then speak to the project supervision and general administration, where we are actually asking you to provide for us the salaries associated with the individuals that are being involved in the project, if there were any durable materials or equipment, any office supplies and materials that were purchased. The training time would be time it took you to be trained for the model, but also we would like you to provide the amount of time that you spend training new individuals to the project. Some of the sites have had the opportunity to bring on new individuals, and as such we would like you to tell us if that training time, how much was it, and was it different than the training time that took for the initial project. If there were any space or utility cost incurred in order to deliver the model, then please provide us that information as well. Once you've completed a form, please review it and make sure again that it is defendable and replicable, that you feel comfortable with the numbers going forward, that it makes sense to you. Look again at it to think if there were other costs that you might have incurred that were not included, other time spent, or you may have looked over something and meant to write it down and perhaps you didn't. So please double check it before you send it to us. It's important also that you tell us what your unit of analysis was used, in that if it were hours per week, per encounter, or per month. If you have any questions about that, please email Dr. Schomer. Also, if you think you incurred something that was an avoided cost, if you have identified an avoided cost where, for instance, any efficiencies attained, did you notice any problems that were able to be avoided? This kind of information helps us better understand, as the model is delivered at your site, the ways, the nuances to the success that your site has had. Lastly, on the form, again, by staff ID, each individual, please provide this annual salary, excluding the fringe, the percent fringe, and percent time spent. If you are unable or uncomfortable providing that information to us, please let us know, but we would like to obtain from you that individual's job description and or job title, and then what we will do is look for a regionally comparable salary and fringe and so forth, and we'll present that back to you and make sure that you are comfortable with the number that we're coming up with from a regional standpoint. As you complete your forms, again, the staff ID is very important. Please hold on to your decoder. You're not going to tell us who's staff 1, 2, 3, and 4. You're going to keep that information yourself. We just want to know who's number 1, 2, 3, and we just want to know that there is a 1, 2, 3, 4. But that individual that was reflected in January is also going to be the same individual that's reflected in July. If that individual is no longer there, then you simply won't have a staff number 1 in July, and instead you'll have staff number 3 in July. There's a key informant script that was provided, and that is going to be an interview that's going to be conducted by Dr. Schomer with one or more persons at your site to walk through some identifiable and perhaps newly identified opportunities for assessing the economics. Again, we're going to be doing this from January 11th through February 5th. We're going to repeat it again toward the end of the summer. We need all the sites to do this at the same time. We fully appreciate the fact that January is a very hectic time in healthcare settings because of changes in insurance coverage and so forth, and we are hopeful that we're able to still get valid and viable data despite the time period in which we're making this collection. Lastly, I'm going to provide you with our contacts. Michael Shanko at Health HIV is a good contact. And then also for this particular one, please contact Dr. Schomer at the University of Minnesota. And if you, for whatever reason, need to get a hold of, or you can't get a hold of them, or you want to get a hold of me, please feel free to do so. And my contact information is provided there for you as well.